Welcome back, everyone, to Phonic Facts in Depth. Today we are diving deep into a company I bet you interact with all the time.
Oh, yeah.
But their story, it goes way beyond just, those aisles of shampoo and greeting cards. We're talking about CVS Health.
It really is fascinating. I mean, you wouldn't think that just grabbing a prescription or a quick snack
Right.
would lead us down such a fascinating path, but CVS Health has really grown into this massive force in the healthcare industry.
It's not just those corner drugstores anymore.
No?
I mean, we're going to unpack how CVS went from a single store
Yeah.
back in 1963, a single store in Lowell, Massachusetts, selling health and beauty products,
Right.
to this giant with their hands in everything.
Everything.
From insurance
Right.
to walk and clinics. It's crazy.
It is. And what's really striking is how much of CVS's growth, it all ties back to their strategy of acquiring other companies.
Oh, yeah?
Think about it. 1990, they buy People's Drugstores.
Okay.
Boom. Huge chunk of the Mid-Atlantic region right there.
Wow. And then just 7 years later, they acquire almost 2,500 Revco stores.
It's like they were playing a real-life game of Monopoly.
Totally.
Just strategically picking up these properties across the country.
Yeah, and it wasn't just about brick and mortar either.
Right?
They were already looking ahead, to the digital future, snapping up online pharmacies, specialty pharmacies.
They knew they had to. I mean, everyone was moving online. They clearly recognized that healthcare was moving online.
Yeah,
And they wanted to be a part of that.
absolutely. And then things really start to shift, in the early 2000s. They launched the Extra Care loyalty program
Right.
in 2001, which, by the way, boasts a massive membership.
Yeah. Everyone I know has that little red Extra Care card.
Yeah, it's one of the biggest retail loyalty programs out there.
Yeah.
But I think that move into the walk-in healthcare market, that was a real game changer.
Oh, yeah.
With the acquisition of Minute Clinic in 2006, it suddenly became so convenient to just,
Yeah.
get a flu shot or a quick checkup while you're running errands.
Right.
Just pay.
Yeah.
It's like, if you're already there,
Exactly.
why not?
Why not? And then comes the merger with Caremark in 2007.
Oh, yeah.
Creating CVS Caremark, a major player in pharmacy services right there. I mean, this really laid the groundwork for the company that we know today.
And, of course, we can't forget about the mega merger with Aetna in 2017.
Oh, my gosh, yeah.
$69 billion deal, combining CVS's massive pharmacy network with Aetna's huge health insurance arm.
Right.
That's when they they became a healthcare giant.
A giant. And, initially they pitched this idea of a healthcare genius bar,
Yeah.
envisioning a one-stop shop for all your health needs,
Yeah.
from filling prescriptions to seeing a doctor. I mean, it was a bold concept.
Right.
It has, though, raised concerns about the increasing consolidation of power within the healthcare system.
It definitely makes you think about, the potential benefits and drawbacks of such a centralized approach.
Yeah.
And let's be honest, CVS's journey hasn't been without its bumps in the road. We've got to address some of the controversies that they've faced over the years.
Absolutely. Absolutely. I mean, their expansion and ambition have led to some significant legal and ethical challenges,
Yeah.
particularly concerning their pharmacy benefit manager, Caremark.
Yeah.
Even before the merger with CVS, Caremark found itself in hot water
Oh, really?
in the late 1980s and early 1990s, facing allegations of health and Medicare fraud.
Wow.
That resulted in over $250 million
Wow.
in settlements with the government.
That's a hefty price to pay.
It is.
But these controversies didn't seem to slow them down.
No.
They continued to acquire companies, expanding their reach into new markets like Hawaii with Long's Drugs.
Yep.
And targeting the Hispanic community by purchasing Navarro Discount Pharmacy, the largest Hispanic-owned drugstore chain in the U.S.
Yeah, and right, they kept pushing forward.
Yeah.
But some of these expansions, like the acquisition of Oak Street Health, a network of senior-focused clinics, raised eyebrows. I mean, just a few years earlier, CVS was insisting that they didn't need doctors.
That's a great question.
Yeah.
What changed? What was the driving force behind this shift in strategy?
Well, the healthcare landscape is incredibly competitive. Companies like UnitedHealth were already building their own vast networks of doctors. And CVS realized they needed to get in the game to remain competitive. The acquisition of Oak Street Health, with its 169 clinics across 21 states, gave them a significant foothold in the growing market of senior care.
So they went from, we don't need doctors, to owning a whole network of clinics focused on a specific demographic.
Yeah, it's a pretty big swing.
That's a pretty big swing.
And it speaks to a broader trend in healthcare, vertical integration, where companies are trying to control as many aspects of the healthcare process as possible, from insurance to the actual delivery of care.
I see.
You know?
And how does their focus on value-based care, how does that fit into all of this?
Well, that's another piece of the puzzle. Value-based care is all about incentivizing doctors to provide more efficient and preventative care,
Okay.
ideally leading to better outcomes and lower costs in the long run.
So instead of just treating people when they're sick,
Right.
the focus is on keeping them healthy and out of the hospital.
Exactly.
That makes sense from a financial perspective, but are there any downsides to this approach?
Well, there are valid concerns. Critics argue that value-based care could lead to the rationing of care,
Okay.
or it might disproportionately benefit healthier patients. It's a complex issue with a lot of unknowns.
Okay, so we've got this massive company gobbling up businesses left and right,
Yeah.
pushing into new areas of healthcare,
Right.
facing some pretty hefty ethical questions along the way.
Uh-huh.
This is getting really interesting. Where do we go from here?
Well, let's not forget about some of the other controversies
Okay.
that have plagued CVS, in particular their role in the opioid crisis.
Right, that's a big one.
Yeah,
We need to unpack that whole situation.
absolutely. And we also need to talk about their recent foray into dispensing abortion pills,
Oh, wow.
which has put them right in the middle of a heated political debate.
This is shaping up to be one intense deep dive.
It is.
But before we jump into those controversies, let's take a closer look at some of the specific challenges
Okay.
and criticisms CVS has faced over the years,
Right.
starting with some issues related to privacy.
That's a good place to start. Back in 1998, CVS faced a major backlash when it was revealed that they were sharing prescription drug information
What?
with a marketing company called Alensis.
Wait, they were sharing sensitive patient data
Yeah.
with a marketing company?
It was a huge scandal.
That's a major breach of trust.
CVS and Alensis tried to defend their actions, claiming that they were simply trying to educate consumers, but the public outcry was overwhelming.
So what happened? Did they face any consequences?
They did. Faced with mounting pressure and complaints, CVS was forced to end their relationship with Alensis and bring those marketing practices in-house.
It just goes to show how public outrage can sometimes force companies to change their ways.
Yeah.
But unfortunately, this wasn't the last time that CVS found itself in hot water over privacy concerns.
You're right. In 2009, they faced charges from the Federal Trade Commission for failing to properly protect the sensitive financial and medical information of their customers and employees.
Right.
They hadn't implemented adequate security measures, which is a direct violation of federal law.
And if I remember correctly, there were also allegations that CVS's pharmacy chain had violated the Health Insurance Portability and Accountability Act. IAPA, right?
Exactly. They were facing trouble on multiple fronts. It was a real wake-up call for the company, forcing them to reassess their privacy practices.
So how did they respond to these charges?
They ended up settling, with both the FTC and the Department of Health and Human Services agreeing to pay over $2.25 million in penalties.
Wow. That's a significant penalty. It really underscores the seriousness of these privacy violations. It's clear that CVS has had its share of struggles when it comes to protecting patient data.
Yeah.
But they've also faced scrutiny for other questionable business practices.
Absolutely. One example that comes to mind is the 2008 lawsuit.
Oh, I remember hearing about that one.
Yeah.
What were the allegations?
Well, a group of attorneys general, led by those from Illinois and Maryland, accused Caremark, which was then a part of CVS, of misleading doctors about prescription drug costs.
So they were giving doctors inaccurate information about how much patients would save
Right.
by switching to certain drugs.
Exactly. And it turned out that in some cases, patients were actually ending up paying more. It raised serious concerns about whether CVS was prioritizing profits over patient well-being.
That's pretty outrageous. It sounds like they were playing fast and loose with the truth to boost their bottom line.
That was the accusation.
Ah.
And the settlement prohibited CVS from engaging in those kinds of misleading practices. They were forced to be more transparent about drug costs and give patients the ability to decline a switch if it wasn't in their best interest.
Okay, so that's two major legal issues related to privacy and deceptive business practices. But it seems like the scrutiny didn't stop there.
Nope.
They also faced investigations into their handling of controlled substances, particularly oxycodone.
You're right. In 2011, the Drug Enforcement Administration, the DEA, launched an investigation into CVS pharmacies in Sanford, Florida, alleging that they were ordering and dispensing an excessive amount of oxycodone.
This was right in the midst of the opioid crisis, a time when these highly addictive painkillers were being overprescribed and widely diverted for illicit use.
Exactly. The DEA claimed that these CVS pharmacies were ordering enough oxycodone to supply a population 8 times the size of Sanford.
Wait, 8 times the population? That's insane.
Yeah,
There's no way that amount of oxycodone could be justified by legitimate medical need.
that was the DEA's argument.
Wow.
They alleged that CVS was turning a blind eye to red flags, essentially facilitating the diversion of these dangerous drugs.
So how did CVS respond to these allegations?
They issued a statement saying they were committed to working with the DEA and had taken steps to ensure the proper dispensing of painkillers in Florida, but the damage was done.
Right.
This case really put a spotlight on the role of pharmacies in the opioid epidemic and the ease with which these highly addictive drugs were being diverted.
It's a dark side of the pharmaceutical industry that we're still grappling with today. And for CVS, this wasn't the end of their opioid troubles.
Right.
They faced more allegations and lawsuits in the years that followed.
Yes, they did.
Including a major case in 2016 where the Massachusetts Attorney General reached a settlement with CVS for nearly $800,000.
That case was particularly significant because it highlighted CVS's failure to properly utilize the Massachusetts Prescription Monitoring Program,
Right.
a database that tracks opioid prescriptions and helps to identify potential abuse.
So they were essentially accused of not doing enough.
Yeah.
To prevent the diversion of these dangerous drugs. It's starting to feel like a pattern here.
And the lawsuits kept coming.
Right.
In 2020, Kentucky's Attorney General filed a suit claiming that CVS's business practices directly fueled the opioid epidemic in the state.
It seems like the walls were starting to close in on them.
And then, in 2021, a federal jury in Ohio found that CVS, along with Walgreens and Walmart, had substantially contributed to the opioid crisis in 2 Ohio counties.
That was a landmark case. It was the first time pharmacy companies were held liable for their role in the epidemic.
A huge blow to the industry sent shockwaves through the pharmaceutical world. CVS was ordered to pay hundreds of millions of dollars in damages.
Wow, that's a hefty price tag.
It is.
But it's hard to argue that it wasn't warranted given the devastating impact of the opioid crisis on communities across the country.
You're right. And the legal and financial repercussions for CVS continued to mount. Just last year, in 2024, they were ordered to pay another $650 million in damages by an Ohio judge, along with Walgreens and Walmart, for their role in the opioid crisis.
This whole situation really raises some serious questions about corporate responsibility and the role of pharmacies in preventing drug abuse.
It does, and it goes beyond just CVS. The entire pharmaceutical industry needs to reckon with its role in this crisis and take concrete steps to prevent it from happening again.
Okay, so we've covered a lot of ground here. Privacy violations, deceptive business practices, and the opioid crisis. It's clear that CVS has faced some serious challenges, but they've also achieved incredible growth and expansion.
They've certainly come a long way from that single drugstore in Lowell, Massachusetts.
Right.
But their story is far from over.
Right. There's still a lot of unanswered questions about their future, their ambitions, and the potential impact of their decisions on the healthcare landscape. So stay tuned as we continue our deep dive into the complex world of CVS Health. We'll be back after a quick break.
We were talking about CVS and the opioid crisis before the break, and all those legal battles.
It's kind of mind-boggling when you think about it.
It is.
A company that started as just a small drugstore
Right.
has become so entangled in such a complex issue.
Yeah, it really highlights the evolution of the pharmaceutical industry and just the immense power that these corporations now wield.
And as CVS continues to expand, it just makes you think, they're likely to face even more scrutiny and challenges.
Absolutely. Speaking of expansion, we were talking about their acquisition of Oak Street Health,
Right.
which was really a signal of a significant shift in their strategy towards primary care.
Right. It seemed like a complete 180 from their earlier stance of, we don't need doctors. What prompted that change?
Well, the healthcare landscape is constantly shifting, and I think CVS realized they needed to adapt to stay competitive. Companies like United Health were already building these extensive doctor networks, creating these massive integrated healthcare systems.
So they kind of felt the pressure to keep up and secure their place in this evolving market.
Precisely. They recognized the potential of owning clinics and directly managing patient care, especially with their focus on value-based care.
Okay, but, Some people see this as kind of a conflict of interest.
Yeah.
How can a company that profits from selling medications also be responsible for making healthcare decisions?
It's a very valid concern. Critics argue that CVS might prioritize treatments and medications that benefit their bottom line, potentially compromising patient care.
It makes you wonder, are they truly putting patients first, or if it's all about maximizing profits?
It's a complex issue with no easy answers. Regulators are keeping a close eye on these developments, trying to ensure that these mega mergers don't stifle competition or harm patients.
It seems like they're kind of walking a tightrope, trying to balance their business interests with their responsibilities to the healthcare system as a whole.
And they're not just navigating these complex financial and ethical issues, they're also wading into politically charged territory.
You're talking about their decision to start dispensing abortion pills.
Exactly. In 2023, following changes in FDA regulations, CVS announced they would begin dispensing mifepristone, one of the medications used in medication abortions.
I can only imagine the firestorm that ignited abortion is such a divisive issue in this country.
It was a bold move by CVS, and it immediately drew criticism and praise from both sides of the debate.
Right, you have those who applaud CVS for increasing access to essential healthcare services,
Yeah.
particularly in states where abortion access is limited.
And on the other hand, you have those who accuse CVS of promoting abortion and contributing to the moral decline of society.
Seems like they found themselves right in the middle of the culture wars.
They did. And this decision sparked protests, boycotts, and even legal challenges.
It really highlights the challenges of navigating these ethically charged issues, especially for a company as large and influential as CVS.
Yeah, it raises questions about corporate responsibility, the role of pharmacists in dispensing controversial medications, and the broader societal implications of these healthcare decisions.
Speaking of ethically charged situations, didn't CVS recently face backlash over a medication error that had really devastating consequences?
You're referring to the incident where a woman undergoing IVF was mistakenly given the wrong medication.
Yes, it was a tragic case. The woman received misoprostol, a drug used in abortions, instead of the medication she needed to support her pregnancy.
It was a heartbreaking situation. The woman lost both of her embryos due to this error.
This incident really underscores the importance of pharmacy safety and just the potential for human error, even in a highly regulated industry.
It's a stark reminder that behind these large corporations and complex healthcare systems, there are real people whose lives are deeply impacted by these decisions and actions.
It makes you think about the pressures that pharmacists face, especially in a fast-paced environment where efficiency is often prioritized.
You're right. There's a lot of discussion about burnout and staffing shortages in the pharmacy industry, and this incident highlights the need for adequate training, support, and safeguards to prevent these kinds of errors from happening.
It's a very complex issue with no easy solutions, but it's clear that patient safety should always be the top priority.
Absolutely. And this incident serves as a wake-up call for CVS and the entire healthcare industry to reevaluate their practices and prioritize patient well-being above all else.
Okay, so we've delved into some pretty heavy topics here. The opioid crisis, the abortion pill controversy, and the tragic consequences of medication errors.
These are just a few examples of the complex ethical and social challenges that CVS faces as it continues to grow and evolve.
It makes you wonder what the future holds for this company and the healthcare industry as a whole.
It's clear that CVS is aiming to become a dominant force in healthcare, a one-stop shop for all your health needs. But their journey is paved with challenges and controversies.
And as we wrap up this deep dive, I think it's crucial to reflect on the broader implications of their actions and the potential consequences of their ambitions.
You're right. It's not just about CVS. It's about the direction of healthcare in this country and the role these massive corporations are playing in shaping our access to care.
So as we move into the final part of our discussion, let's consider what CVS's trajectory means for the future of healthcare and what we as individuals can do to ensure that our voices are heard in this evolving landscape. We've covered a lot of ground, in this deep dive into CVS Health.
From their humble beginnings as a single drugstore to their current status as just a healthcare behemoth, it's really something.
Right.
I mean, their journey's been marked by both impressive achievements and significant controversies.
Yeah, it's clear they're aiming to be a major player in the future of healthcare, but their path forward, it's fraught with all these complex ethical and social dilemmas.
And their decisions have these far-reaching consequences, not just for the company itself, but for the millions of people who relied on them for their healthcare needs.
It's a lot to consider. Where do we even begin to unpack all this, the broader implications of CVS's ambitions and the potential impact on the healthcare landscape as a whole.
Well, one of the key themes that we've touched on throughout this whole discussion is this increasing consolidation of power
Right.
within the healthcare industry.
Yeah.
CVS's aggressive acquisition strategy
Right.
is a prime example of this trend.
Yeah, they've gone from owning drugstores to acquiring pharmacy benefit managers, insurance companies, and even doctors' offices.
Really something.
It seems like they're trying to control every aspect of the healthcare process.
And that raises concerns about competition, pricing, and patient choice. When a single company holds so much power, it can be difficult to ensure that patients' best interests are truly being served.
It's a valid concern. Are we heading towards a healthcare system where a handful of massive corporations just dictate the terms of our care?
It's a question we need to be asking ourselves, and it's not just about CVS. It's about this broader trend of vertical integration in healthcare where companies are merging and acquiring their way to dominance.
Right.
You know?
It's a complex issue. Are there any easy answers?
No, there aren't. There are potential benefits to this kind of consolidation, like increased efficiency and coordination of care.
Right.
But there are also some pretty significant risks, like reduced competition and higher prices.
And we can't forget about innovation.
That's right.
When a few companies control the market, it really stifles creativity and could limit the development of new treatments and technologies.
That's a good point. We need a healthcare system that really encourages innovation and provides patients with a wide range of choices, not one that's just dominated by corporate interests.
Exactly.
Yeah.
So as we think about the future of healthcare, it's crucial to be aware of these trends and to advocate for policies that promote competition, transparency, and, patient empowerment.
Right. And we need to hold companies like CVS accountable,
Yeah.
For their actions. Their decisions have a ripple effect throughout the entire healthcare system, impacting millions of lives.
This deep dive has certainly been eye-opening.
It has.
It's given us a lot to think about in terms of the challenges and the opportunities facing the healthcare industry as a whole.
And it's really highlighted, I think, the crucial role that each of us plays in shaping the future of healthcare.
So as we wrap up this discussion, I want to leave our listeners with a few key takeaways.
Okay.
First, it's important to recognize that the healthcare landscape is constantly evolving.
It is.
Companies like CVS are adapting and expanding, often in ways that raise these complex ethical and social questions.
Right.
Second, we need to be aware of the trend towards consolidation and vertical integration in healthcare. While these mergers and acquisitions can offer some benefits, they also pose significant risk to competition pricing and patient choice.
And finally, we need to remember that we have a voice in shaping the future of healthcare. By staying informed, engaging in discussions like this one, and advocating for policies that align with our values, we can help create a healthcare system that is equitable, accessible, and truly serves the needs of patients.
Thanks for joining us on this deep dive into CVS Health.
We hope this conversation has been informative and thought-provoking.
Until next time, stay curious and stay engaged.